Are you a nurse practitioner or physician assistant who runs your own practice and you just have so many things to do all day, every day? I want to provide a tool that really is going to help cut down on some of your long hours, which is using ChatGPT and specifically today, using it to help with patient education and communications. So stay tuned. We have some concrete examples that will really help you out. Hi, I'm Dr. Annie DePasquale, the founder of Collaborating Docs, and I'm here today to share some of my advice on how to best use ChatGPT. If you've seen prior videos, I've touched on some overall basics of ChatGPT, which are to always use a good prompt, tell ChatGPT the tone and style that you want to use in your whatever documentation that you're creating. Be sure to mention your role, your practice type, so it's more specific to your situation. Don't be afraid to ask for details. It's uncommon that the first thing ChatGPT spits out is the best. You need to reiterate it. And then be sure to use your own language and your own good common sense. Does it sound like me? Is this the sort of advice I would give? And make sure it's all adding up. And be careful at the end when you copy and paste it that you're only getting the part that you want and not the little add-ons at the beginning and end that ChatGPT adds. So specifically today, I want to talk about patient education and communication. So what can ChatGPT do for you in this realm? It can create custom health guides like simple explanations of conditions, treatments. It could help with FAQ responses. So common patient inquiry, you could use it to prepare responses to those. Patient follow up templates like post visit summaries, check ins, and automated chat scripts, for example, your front desk to use. So today I want to focus the example on a custom health guide. So we could give ChatGPT a prompt like this: write a one pager regarding home care for the common cold. So all you would do is insert that here and it will spit something out. It'll probably be very solid, but also very generic. Like anyone could have written this for anyone else. And it's not real specific, to you or your clinic. So another option is to be a bit more specific. So I am a family nurse practitioner. I run my own telemedicine practice. Please write the one pager. So let's see how that kind of changes things. So if I was a nurse practitioner, I wouldn't want it to say when to see a doctor, obviously, when to see a medical provider. But in any case, let's see what this one does instead. So it should be a little bit more on the nose. It is letting me add in my clinic information and my information. So that's already kind of a step in the right direction for branding um, purposes. The content probably is pretty similar, but I think it'll make a change at the end, if I'm not mistaken, regarding following up with you specifically. Yes. So it'll be nice. It can add in, your website, your phone. So that's already much better. And then this is a final version, but it specifically including clear instructions to follow up with me as the provider if symptoms are not improving in 5 days or sooner if more severe symptoms begin. So it's a little more like, policy procedure, like what I really specifically want to happen. So you can kind of see it'll probably be toward the end. And I apologize. It takes a minute for it to load. So we'll have to hang tight for a second. But it's, clarifying probably quite similar to what was up above, what to do at home. But then at the end, it probably will be a little bit more specific about the follow-up plan. So yeah, I like this schedule and I like the little, icon there. If symptoms do not improve, if symptoms are worsening, seek immediate care if these sort of things are happening. So um this is definitely the strongest version, and then it's re-emphasized here about the 5 days. So sometimes people scan it and don't read everything, but they hopefully either caught it up here or then they'll catch it down here. So that is the best version. And it even offers, do you want a printable PDF? And then you can just say yes, and it will draft it as that for you. We will not hang on to see it because I don't want to make this video longer than necessary, but I hope this tip helped, and I encourage you to use ChatGPT as much as humanly possible. Take care.